The following presentation is, the purpose of this presentation is to show you the relationships and linkages found between a generalized anxiety disorder and our physical health. Some of the physical health issues or disorders we're going to be looking at in correlation with GAD, also known as generalized anxiety disorder, include insomnia and or sleep disorders, gastrointestinal symptoms, heart disease, sexual dysfunctioning, and breast cancer. In order to get a better understanding of how our mental health affects our physical health, we have to first define what GAD is. And according to the Anxiety and Depression Association of America, symptoms of a generalized anxiety disorder includes persistent and excessive worry about a number of different things. And people with GAD may anticipate disaster and may be overly concerned about money, health, family, work, or other issues. Individuals with GAD find it difficult to control their worry. And it's important to note that generalized anxiety disorder can be characterized by both physical and mental symptoms. So according to Mayo Clinic, such mental symptoms include persistent worry or overthinking plans and solutions, difficulty handling uncertainty, and physical symptoms include fatigue, trouble sleeping, muscle tension, trembling, feeling twitchy, nervousness, sweating, or irritability. One of the first linkages we're going to be looking at between GAD and is with your gastrointestinal system. So just as a refresher, when we're under stress, our sympathetic nervous system, also known as the fight or flight mode we go into, is activated. And when the sympathetic nervous system is activated, when we are under stress, we release the hormones adrenaline and cortisol. And these chemicals released by your body will enter your digestive tract where they interfere with your digestion. And they have a negative effect on your gut flora. And your gut flora is the microorganisms that live in your digestive tract and aid digestion. And the release of such chemicals also decrease your antibody production. So this bit of research I'm going to be sharing with you is about the gut microbiota, like I mentioned, and the neuroendocrine system. So the microbiota is the gastrointestinal tract of all mammals. And the following research found that one of the systems that interacts closely with this gut microbiota is the hypothalamic-pituitary-adrenal axis, also known as the HPA axis. And this HPA axis is our body's central response system. So early life stress affects the function of various areas of the brain that are able to modulate this HPA axis, such as the amygdala, hippocampus, and prefrontal cortex. And as we know, the amygdala is associated with mental health disorders such as anxiety. And the following table represents the factors in red arrows as activators of the HPA axis, and the green stems as factors that inhibit the HPA axis. So the researchers manipulated the HPA axis in mice by increasing the amount of stress through the factors shown in red. And what their results showed is that there is a strong interaction between the gut microbiota and the neuroendocrine system. So as you can see, the factors in the red arrows, such as psychological stress, are going to activate this HPA axis, whereas something that's going to reduce psychological stress, such as maternal care, are going to inhibit this axis, and therefore showing you the correlation and the relationship between the two. And the next study we're going to be looking at is the report of the association between anxiety disorder and major adverse cardiac events, also known as MASE. And they wanted to report the anxiety disorder prevalence in patients with coronary heart disease in order to report the efficacy of anxiety disorder treatments in CHD. And so the associations commonly, the associations of a generalized anxiety disorder, such as rapid heart rate, increased blood pressure, decreased heart variability, are commonly associated with the symptoms of a coronary artery disease. And this is by no means to say that they are directly correlated, but symptom reduction in one may help symptom reduction in the other. So the research done on patients with CBD, also known as cognitive behavioral therapy, with chronic heart failure. So the patients were psychologically assessed to determine if they had a generalized anxiety disorder, and they were also given cognitive behavioral therapy. And what they found was through the cognitive behavioral therapy, the researchers were able to significantly reduce the symptoms of patients with chronic heart failure. The next bit of research we're going to be looking at is the relationship between generalized anxiety disorder and sleep quality. So this research sought to investigate sleep spindle activity in children diagnosed with a generalized anxiety disorder, as well as examining the relationships between sleep spindle density and anxiety symptoms. So 58 children ages 7 to 11 were studied by using a clinical assessment and diagnostic interview to assess if they had an anxiety disorder, and sleep spindle activity was detected through software. And their results concluded that feelings of worry were positively associated with sleep spindle activity, and the repetitive thought processes such as worry are characterized by an increased activation of fibers that connect the thalamus and cerebral cortex, which is a similar representation of the repeated activation of spindle production. So as you can see by this graph, the sort of consistent up and down motion of the sleep spindle portion of the sleep waves mimic the way our brain processes feelings of worry. Another bit of research we're going to be looking at that sort of connects generalized anxiety disorder to sleep quality actually looked at patients' sleep quality during a pandemic. So they were given a Likert scale to measure their anxiety and a PSQI, Pittsburgh Sleep Quality Index, to measure the quality of sleep. And what they found was a high prevalence of generalized anxiety disorder was associated with poor sleep quality. And these findings were very similar to the SARS outbreak that the researchers had previously done. And what we can conclude from this is that during a stressful time in our lives, such as a pandemic, we can expect people to experience a poor quality of sleep. And this is prevalent in multiple pandemic outbreaks. The next research we're going to be looking at is the correlation between a generalized anxiety disorder and sexual dysfunction. So we're going to be looking at men with erectile dysfunction as well as women with vaginismus. So the findings from the research on men with erectile dysfunction found that the stressors associated with GAD detract from the stimuli that are intended to help with sexual stimulation during sexual intercourse. And this was more prevalent in patients aged 45 to 54. And they also concluded that the stressors associated with GAD also typically led to premature ejaculation. And with women, a study was done on women with lifelong vaginismus, and what they found was patients with phobias and other anxiety disorders showed a stronger relationship to having this disorder. And the last bit of research we're going to be looking at is with breast cancer patients and how the prevalence and associated factors of depression and GAD in breast cancer patients can affect their symptoms as well as their recovery process. So we're going to be looking at immunosuppression and how emotional distress is associated with an increased difficulty coping with the side effects of cancer treatment and possibly a higher risk of mortality. And so the following research studies the assessment of depression and anxiety in breast cancer patients, as well as the prevalence and associated factors. And the data was collected through face-to-face interviews, individual characteristics, as well as PHQ, the Patient Health Questionnaire, and the GAD-2, the Generalized Anxiety Disorder Questionnaire. And they concluded that the women who were already in a burdened state after the diagnosis of breast cancer had difficulties such as mastectomies and chemotherapy, as well as family and social problems that escalated this condition. The psychological stress has been associated with poor physical function and a higher mortality risk. And they found that patients diagnosed with stage 4 of breast cancer were in a high risk for depression and anxiety compared with stage 1 patients. And this confirms previous studies that concluded that depression and anxiety are associated with higher symptom burden and worse physical functioning. And it's also important to note that treatment of mental health disorders is one of the 6 vital signs in cancer care. So we can note that treating mental disorders such as a generalized anxiety disorder can significantly help a breast cancer patient's recovery process. And the conclusion to all of these findings is that with generalized anxiety disorder, as well as the many, many health complications that I previously mentioned, they are very multifaceted, and there is by no means a cause and effect relationship between the two. But what we can conclude and what we have seen in research is that the treatment of your generalized anxiety disorder or mental health disorders can actually lead to symptom reduction in other physical health conditions. So generally, we can say that taking care of your mental health can greatly benefit your physical health. And the ways that you can do that is through exercise, talking to a psychiatrist, having a support group, as well as treatment options for a generalized anxiety disorder. And this can include medication, psychotherapy, or self-help.